Hello, my name is Trent and I'm a student physical therapist. And today I'm going to demonstrate the anterior and posterior glides of the proximal radial ulnar joint. The proximal radial ulnar joint is located right here in between the ulna and the radius. The use of this joint is to mimic or to support pronation and supination of the forearm. During pronation and supination, the radius moves most on the stable ulna. The arthrokinematics of this joint is a little controversial. Newman describes this as a pure spin motion during pronation and supination. Newman states that the convex head of the radius is completely spherical, and due to the anatomy of the annular ligament, it keeps the radial head completely within the radial notch of the ulna. During pronation and supination, only a spin occurs. This is refuted in an article by Wiseman, 1992, and he states that the arthrokinematics is a roll spin. For this reason, he's saying that the radial head is not completely spherical and is actually a little oblong, so that during pronation and supination, there is some roll slide. During pronation, or during supination, you get a posterior lateral roll with an anterior medial glide. During pronation, the opposite occurs. You get an anterior medial roll and a posterior lateral glide. The mobilization that I'm going to demonstrate is going to use the roll slide arthrokinematics to improve pronation and supination. I'm going to demonstrate this now on a patient, and for this technique, you want to stabilize the distal humerus with one hand in this position here, close to the joint line, and the other hand will be placed on the radius on the proximal portion of the radius. Both of the thumbs are right at the joint line, so you can get specific which motion you want. With this patient, I'm going to first demonstrate a restriction in supination. With supination, as I said earlier, you're going to have a roll slide anterior medial and a glide posterior lateral. I want to be in the open pack position for this motion, which, as you can see up there, is described as 70 degrees of flexion with 35 degrees of supination. The closed pack position, if you want to assess other joint integrity, is just 5 degrees of supination, and the capsular pattern of the proximal radial ulnar joint is equal between pronation and supination. So at first, you're going to get the patient positioned in a manner that they are seated with their ulna fully supported by the table. The elbow is bent up to about 70 degrees of flexion. You can utilize a pillow or your other arm or the mat to maintain the 70-degree angle. Again, I will demonstrate what this will look like on the patient. I'm going to hold your arm here and here, and what I'm going to do is assess the mobility of this joint within your arm. This joint helps you move your hand over and under, and what I'm going to do is to improve your ability to roll the arm over. So I want you to maintain your arm in that position, one hand on the radius, one hand stabilizing the humerus, and I'm going to perform a grade 3 mobilization in a posterior lateral direction. A grade 3 mobilization defined by Maitland is a large amplitude at the limits of the joint tissue. So I am going to grab the radius and mobilize it posteriorly in this direction to allow it during the roll to slide posterior lateral. If I wanted to improve supination, I would give a glide anterior and medially, and I will demonstrate that now. I'm going to grab your arm here and pull this way to improve the rotation of your hand in this direction. The hand positions are the same. After this, you always ask the patient to reassess the motion that's available. Are you able to move your hand over and under more?
Yes.
All right, good. And that is anterior and posterior glides of the proximal radial ulnar joint.